At 5:30 begins with the shutdown of Providence Health System's emergency and hospital room. It's the final phase before a shift in direction for the center. Neighbors who depend on these services now are left wondering what's going to happen to them. Jess Arnold spoke with some people concerned about where to get health care.
Thank you for calling Providence Hospital. Providence Hospital is now closed.
An unwelcome sound for patients calling Providence Hospital, coupled with an unwelcome sight for those driving by.
See, you hear it, now you hear it. And they're going in the opposite direction. They're not going over there because they can't go over it anymore. They closed that yesterday.
That's why you don't see emergency on this sign anymore. After serving Northeast DC for more than 150 years, Providence Hospital officially closed as of April 30th, 2019. Folks like Ricky Evans, who's lived in this house around the corner from the hospital for 20 years, counted on Providence for emergencies.
You know, I get little abscesses so on my back, you know, where that if I somewhere Howard University and with my doctor, I had to wait for an appointment day, so I couldn't wait. So I had to use them and always use them as backup.
Why are they eliminating hospitals in Washington, D.C.?
Ascension, Providence Hospital's parent company, says it's working on transforming this center for the neighbors, issuing a statement that it is reinvesting and redeploying its resources from hospital-based care to primary and community-based services, including an urgent care center coming soon. Meanwhile, neighbors like the elderly woman who approached Philip Lee this afternoon as he was working in his yard have to go elsewhere.
She said, I'm not feeling good. She said, I live in the neighborhood. I used to go over to the hospital, go over to the emergency. She can't do that. So now she's over to Washington Hospital Center. That's where she went. And I'm saying, that's ridiculous.
The nearest hospitals are Washington Hospital Center, about a 12-minute drive away, or Howard University, about a 20-minute drive, which neighbors say can be a challenging commute for the elderly or those without cars.
I think it would put a lot of people in jeopardy who don't have, standard, health care.
You're really hurting people. You're messing with people's lives, and you can't do that.
In Washington, Jess Arnold, WUSA 9.
We reached out to Washington Hospital Center to see if they're anticipating or already feeling an impact of the closure, and we're waiting to hear back.